Good evening, everyone. My name is Cole. Sorry, my name tag here actually says Anthony Gavalas. He's one of our well-connected residents here who has access to a premium Zoom membership. So we're borrowing that for a minute. But I'm the one you got emails from. I appreciate you guys all showing interest and willing to spend a few minutes here learning about research with us. I promise we won't take up too much of your time, but I have a couple other residents here hanging out with me during our chat as well.
Yeah, I'm Cole, also Cole Patrick. I'm one of the PGY3s. We got John Scanlata back here. He's a chief. He's graduating soon.
Yeah,
that's fine in the back.
So this is meant to be like super informal. So feel free during this, just give us your thoughts, questions, anything on your mind. Thanks for those who submitted some questions on the Google Doc. We'll definitely address those, but by all means, if anything comes up, let us know. Feel free. You can leave your, video off, mics off. What I'm actually going to do at this time is kind of transfer the meeting over to Alexis Sandler. She's one of our other residents here, and she is particularly active in research. All of us take part to varying degrees, and it's what makes this program pretty successful in research. But Alexis definitely knows her way kind of around it, and can, I think, appropriately give you guys a good starting point if you're looking to get involved in research, but also even if you're already kind of working on some stuff during medical school and wanting to know kind of how to, use that to your advantage while preparing for residency. She's a great resource. So feel free to pick her brain as she goes through this stuff too. But feel free to take it away, Alexis.
Thanks, Cole. Sweet. Sounds good. Let me get the PowerPoint up. I'm not going to try to kill you guys with PowerPoint because that sucks. All right, let's see. And then, okay. So my name is Alexis. I'm one of the interns at PGY1. I will preface this with I'm not an expert on anything research related, but I enjoy research a lot, and I have learned a lot of lessons the hard way, and hopefully I can spare a couple of you from learning them the hard way too. Most of what I learned is from John in the back there, the chief. So please, everyone jump in at any point. If anyone also wants to ask a question, either just like turn your mic on and ask it. Let's try and keep this informal so it's not painful or boring. Okay, so research, how not to hate it, because a lot of people do hate research and we don't want that. That's bad. So I put this slide on here. There are a bunch of different types of research, and in deciding what type of research you want to do, you really need to think of a lot of things. The first one being time. So you can start some bench study, work on it. Well, one of the bench studies I started when I was in high school just got published last week. That's not very helpful for any sort of residency application. Not super useful by any means. So resources too, do you have access to what you need to do? Support, expertise, administration, all that stuff kind of comes in together. I think a couple of the best ways to start out doing studies as a medical student, you have to find a mentor, and I'll get more into that later. But case reports, case series are always helpful. Any sort of observational study is also really useful. And then systematic reviews, meta-analyses are kind of things you can do at home or in a coffee shop or whatever, and you don't actually have to be in a hospital or have access to hospital records, which is very nice and makes them very fruitful for getting published. Ooh. So first, quickly on how to find opportunities. It is really hard to find opportunities sometimes, and you do have to go and actively meet people. So individuals, anyone you can find, any surgeon who's interested in doing research, they typically tend to emerge at kind of whatever institution you're at. Everyone always says, oh, I do research with XYZ, and you can figure it out from there. Obviously, if your medical school has any programs that sets you up with projects, that's awesome. MSOS, Medical Student Orthopedic Society, is a great organization started by Alex Gu at GW, who's one of my close friends. And they have a system now where they can set you up with people who want to do research or mentorship, and it's really, really helpful. Outside institutions are also great. The only problem is most of them, it's really, really hard to get access to actual data. So if you can find someone else to pull data, find someone else to get those numbers for you, and you can write a paper, that's also a really good way of getting it done. There are a bunch of organized research fellowships and research years. You should definitely look into those, especially if you are interested in a year to take some time. But again, those are kind of more of a competitive formal application process. And if you're trying to improve your application to residency and you have a full year to do it, that's awesome. But most people don't want to do that. And I definitely did not. So bunch of ideas. So how do you find ideas? That's really, really hard as a medical student. And I think the most important thing for all this idea is that you need to find a good mentor. You need to find someone who supports you and will challenge you and will not just kind of make you do the easy tasks and kind of set it off from there. So for existing research, it's awesome. You can see what the trends are. You can follow the trends and then kind of think of new project ideas. We use one database, which I now cannot stand. But either way, a different story. We use this one database and it was based off of a different paper that we saw published on ankle fractures. We ended up using it for elbow dislocations and all these volleyball injuries, all these other things. So you can find existing research and then kind of make it your own. In terms from your cases, I think a lot of my ideas that I've gotten from research for helping prior when I was in medical school came from the surgeon saying, I wonder what this is. And then you saying, oh, that sounds interesting. I could do a systematic review on that. Or, oh, let me look into that a little more. Conferences are phenomenal. They are really good opportunities to meet people and then find mentors and work on finding different ideas for projects. If you have opportunity to go to a poster hall, definitely go walk through, take pictures of the ones you think are interesting and that you could replicate at your own institution with maybe a different subject. That's a good way to brainstorm as well. And then this is my favorite social media, really random. But a lot of people, if you follow some people who like really are really into the whole social media thing on Twitter, especially, I think I DM'd one attending who said, anyone want authorship on this paper? And I ended up not wanting to do it just because I couldn't find a nice database that would let me. But he was like super supportive and interested in getting it started. And I think that adds a super reasonable way to start doing research or at least get your name or your foot in the door. So this is another kind of interesting one. Oh.
All right, cool. Something else, go back real quick, Alexis. I'm going to try to shut up, but I always talk my ass off. Something else for finding opportunities that I've realized is probably like this hidden gem that somebody could do, especially if they don't have great, some people just are bad at making research ideas, which is totally fine. Like it took me a while to find that art. But if you can get good at doing specific statistical tasks, and I think you may get into this later, but if you could approach somebody and be like, hey, I'm really good at running this type of statistics, that is a really cool way to have an opportunity because you're someone who has a specific talent or skill set. It's kind of like Liam Neeson and Taken, right? You have like a particular set of skills that makes you really effective for somebody. And I've like with GitHub and all these, like I've been teaching myself all these pretty high level statistics using RStudio, which I never learned formally. And it's opened the door for like 4 projects in the past 2 weeks that I've been able to do the stats on that I never was able to do in the past. So if you think that like, man, I'm just not like, I don't have these great ideas because I'm a MS2 and I all I know are like C7 and T1, but you're really good at statistics, then you could find somebody who has great ideas and they're like, yeah, I just don't know how to do the math for this. And all of a sudden you have a partnership that flourishes into something great. I rubbed your shoulder, sorry.
Yeah, 100%, 100%. And being willing to learn how to do those new skills is also like absolutely critical. Okay, so I'm going to kind of get into like a little more of the applicable day-to-day things on how, when you're doing research and things to take into consideration and try to give you like actual tasks that you can accomplish. If someone gives you data, okay, whether that is in the form of the patient data for an observational study, or they send you a bunch of papers for a systematic review or something like that, and I'll get more into how to kind of get that information yourself. There are a couple of things for data handling you want to take care of. And I'm saying this, I think most people have done research at some point in their career with someone who has really dropped the ball. And this is kind of a list of pieces on how not to drop that ball and how to keep yourself organized that will save you heartache and headaches in the future. So when you have a data sheet, when you have data and you're thinking about collecting data, anything like that, start making a data sheet that you can fill in. Try to like minimize the uncertainty in whatever you're doing. So make very simple categories. If you need to write in data, that's great. Have your little write-in column on your Excel sheet, but also have a column that has numbers or something coded that you can actually break it down and make sense of the information in real time. So if you are doing a team project, you strongly should consider using Google Sheets just so other people can see it. Now, as in the med student level, this can really bite you in the ass if you're a procrastinator. We've all done that before. So when you're saying, oh, I'm going to collect the data by next week, and you're like, all right, I'll get it done by Saturday, but I'm going to do it all on Friday night from the hours of like 11 p.m. to 3 a.m. And then it looks bad if you have nothing on there and they keep checking, then you go back. That's up to you. But I think that if they can see that you're actually doing stuff, that's awesome. And then taking notes of the commenting function. If you have any questions, any concerns about your data, highlight stuff in yellow, do your little comment thing, whatever you got to do. That definitely really helps. So, and then the other thing that I'm going to mention too, if you're collecting data from an EMR, is be careful with patient privacy and HIPAA. This can also be a huge issue, and I've kind of watched it blow up in the faces of a couple attendings several times. Usually what institutions have is that you have to collect data on their system, meaning you have to remote in or VPN into their system and then keep it on their computer in an Excel. A lot of places will require you to have 2 separate data sheets, one data sheet for the patient info, like the MRN, the age, if they're over, like I think most places it's like 80 or 85 or something, maybe even 90, because then you can kind of figure out the patient's identity based on that. Date of birth, all that stuff, and then you can have everything else you're collecting on the other data sheet. And then so figure out a careful way of taking notes in your method section. I typically, this is like the dumbest way to do it. And if you can think of a smarter way, you should do it. But the dumbest way is to start a Word document and say, this is my working draft of my manuscript, and put bullet points as you do stuff like, oh, I looked up these databases on this date at this time, or, oh, I pulled the patients with this ICD code on this date up until this record number. And then when you're working with residents or attendings, I think it's always, communication is like the most important thing whenever you're doing part of this teamwork stuff. I strongly recommend sending a group of questions at a time, preferably in bullet points. And if you can, under 12 words per bullet point, just because attention span is very limited, and you're more likely to get an answer if you say yes, no question in a couple words. And I see that the other residents are smiling because they have also found this to be true, especially depends on who you're working with, but especially with some people over others. And you will definitely impress people. I frequently bold parts of my emails that I actually want them to read, and then just leave the rest of it, the part that's not important that you can kind of extrapolate, just unbold it and they won't answer to that. And also, I'm just apologize in advance. This is relatively tongue-in-cheek, so hopefully no one is offended or thinks that we're horrible people because of it. So this is an example of something I use to do data collection. So, and then this is the yellow and the blue, just me kind of keeping a running tab of the averages as we go. So the yellow this is for weighted means for a paper we recently got accepted into a journal on subacromial balloons. And I won't give too much away about it just because it probably is still coming out, but this is the basics of our data sheet. So you can see that on the bottom, under the different sheets I have on Excel, I have the study characteristics, demographic, range of motion, patient reported outcomes, adverse events for each kind of patient group that I was looking at. And then you can see I just used numbers. And for this one, if you are ever doing a systematic review, try to collect means and standard deviations. Just as this kind of a side note, it is usually important to have a standard deviation somewhere down the line for other statistics. But you can see that I'm just putting in numbers here. I have places where I write notes, or like this one was active, this one was passive, and I ended up, as you can see in the little yellow, I deleted all the passive ones, just kept the active range of motion. All that stuff is super important, but you can see that I'm using the color, I'm using my notes keys, I have comments on a couple studies, stuff like that. And staying organized is so important in this. And this is like a nice clean spreadsheet that I know what the numbers mean and that I can do something with in the future. So then I am going to mention, for anyone interested in doing systematic reviews, check if your institution has Covidence. It is COVIDENCE. It's an awesome software for organizing your papers. It makes everything super easy. You just import your references, and then it gives you a yes, no thing for, do I want to screen this? Do I not want to screen this? And then there's a bunch of different features on it. They have an awesome YouTube channel. All their stuff is really, really helpful. A lot of institutions do have access. If you need to use it and your institution does have access, just shoot me an email and I will work something out, because there are ways to get around the paying for software that should not be paid for. So then I'm going to actually go into the basics of writing a paper, and these are just some kind of simple notes here. So I'm going to do it in the order that I actually write the paper. Everyone has a different way to do this. Scan, if you want to jump in with how you do it, like please feel free to, but this is the basics and the early part here. So I always start with my methods, and I write those as I'm actually doing them in real time. So if I do it,
oh, nice. You saw my hand raised.
I did.
One thing before you get into this, because I previewed your slides and they're amazing. The data collection part, I'd say, like I tell everybody who gets some degree of proficiency with research, you always want to try to bring other people to teach them how to do things the right way. And I've worked with, or tried to work with, a lot of people, and I've continued to work with a decent amount of people, but that number is far fewer, probably by an order of magnitude. People have totally burnt bridges by doing horrible data collection. And if someone can't generate accurate data and you're trying to get started in research, it calls them to question like the validity and the accuracy of everything else that you do going forward. And it sounds really judgmental, but it's analogous to residency. If you're somebody who cannot accurately present what you saw, or you have a tendency to mince words and or not be totally forthcoming. It doesn't matter how skilled your hands are or how good your brain is, you're never going to be trusted. So I know it sounds really extreme, but a lot of times like you'll get this data set and it's not formatted great, numbers are missing, things are in different like formats. It's just disgusting. And then how can you ever go forward from there when you're working with a mess to begin with?
Yeah, 100%. And trying to revise an already like deeply messed up data set is miserable and nearly impossible and is like wrought with errors for sure. So with the methods portion here, on the right, I have guidelines for different study types. These are what will guide most journals that are kind of worth submitting to will require these as part of your submission. They will require you to follow one of the checklists. And the nice thing is, this is like science. We're not writing novels here. It tells you exactly what it wants, where it wants it, what section it wants it in, and how detailed you need to be. You will probably be using Strobe and Prisma most often.
Okay, so
I think someone has a mic on. Everyone just check your mic real quick. Unless you want to ask a question, in which please interrupt. So this one is part of, so for example, this is like the Strobe. I just like cut out the method section just so you could kind of get an idea of it. They have different numbers and they tell you exactly what they want. They tell you what they want in their study design, how much they want to know about your participants, your variables, all this stuff. This will make your life so easy. You're kind of just following a script, and it's a script that everyone knows and likes, and everyone who's been reading scientific papers is comfortable with and wants to see more of, and it just kind of flows with your brain after a while. So this is really helpful. And then also, because it's part of your med school curriculum and will be in residency too, when you're critiquing articles, you can kind of like pull this up either in your brain or in real time and then be like, oh, wow, this study didn't talk about any of their bias calculations. That's kind of messed up. Who's paying for it, sort of thing. So that helps as well. And this is the same one for Prisma. For the systematic reviews, it tells you exactly what it wants in methods. And it is kind of an art to figure out how to address some of this, like reporting your bias assessment. There's a bunch of different tools for it. Some are miserable, some are really efficient and helpful. I always use Miners if I want to look that up. It's not technically a bias assessment, but it's a quality assessment, and most journals like it. So if that's any help. So then I keep putting in like excerpts from this paper, and again, it's already been accepted, so it's not a huge deal. That like, no, you can't steal it if you want, but if you want to try, I'm kind of curious to see how that would turn out. So you can see that we have our different databases in there, just like in the Prisma thing, what our search terms, what the day we search, all that stuff. And this is kind of just running through like search strategy and study selection. And then I go into a section on data collection, and then a section on statistical analyses. And typically you do want your stats section last. That's kind of classically how it's always done in journals. And this helps when you're looking at a cool study. We're like, oh, I wonder if I could do those stats. If you scroll down to the last paragraph of their method section, you know it's going to be right there. So then into your results section, this is a little more kind of big picture ideas. So before you start writing your results, you do want to check your journal guidelines and have an idea of how many tables you can have. It's a really crappy feeling when you make like 12 beautiful tables and the journal's like, oh, we only accept 7. And you're like, well, which ones do I take out? They're all perfect. And it feels like you're sacrificing a child or something. So just have a kind of idea of what you're allowed to do in the journal. And then I should also go back a little bit and mention, you should have a target journal in mind, just because every journal wants things different. There are certain journals, certain hand journals that are miserable to submit to and have everything a certain way. And if you write an article for another journal, you can't submit it there based on what you already had. And it's absolutely painful. And there are other journals, other specialties too. I'm not meaning to call out that one journal, but it can be very, very difficult. So just know what your journal's rules are, and then that'll save you a lot of time in the future. So then sorting your information into themes is the next most important part, because your themes will guide your tables, and they will guide how you're going to run your results section, which in turn will guide how you're going to run your discussion section. So draft your figures and tables, at least outline them, have an idea of what you want. And then subheadings are really critical. You don't want, every now and then you'll see a paper that just has like 3 thick paragraphs of completely different topic, and it's jumping around, and you're like, wow, I was just curious about their range of motion, and I have to read this whole freaking paragraph to find out what the range of motion said. So make it into like bite-sized pieces that your reader can actually understand. And then this is another thing, try not to repeat your numbers in the figures and tables. A lot of peer reviewers will comment on this if you have a number written twice. I think the best way to approach this typically is if you're going over, let's say, range of motion data, you can say external rotation was most limited, and then you put your numbers in parentheses there, and then followed by XYZ, but don't list all of your range of motion values because they don't want it to be written in the tables and also written on the actual study. And then it's really important here, you need to report in this results section and do not interpret. And this is like what's most fun about the paper. You can write your results section if you have the data super, super fast. You're just putting your numbers down there and just saying exactly what you found in nice little neat and organized categories. Kind of like you're turning your spreadsheet into a Word document with very pretty tables, and your tables are really the thing that matter the most. In general, most surgeons tend to be pretty people who don't necessarily learn by reading an entire textbook. If you're just looking for one fact, we all just want to look at a table and say, that was what I was wondering, and now I understand. So that's kind of a helpful thing to keep in mind too. So you can see for a results section here, I have a couple different mini paragraphs under each subheading, and each one's talking about a different kind of finding or a talk. So typically though, the first paragraph of the results, I'll do my little demographic blurb saying we have this many patients over this much time period. These are what we did. And then a lot of times if I do want to reference something that I have in a table, I'll just say this information is presented in table XYZ, which is also helpful. And then also look up how the journals want to have your statistics written. It sounds really stupid. Most don't want a 0 in front of the p-value, which a lot of people probably know, but technically it shouldn't be 0.001. It should be 0.001. But just like having a good understanding of that is also helpful. So then the discussion is like the kind of like the meat and potatoes of your entire paper. The discussion, while if people are flipping through a journal, it might not be the first part that everyone reads. It will definitely be a critical part for the peer reviewers when they're deciding whether your paper is going to get into their journal. So and I'm going to try and give you kind of like a way to break it down here. I strongly recommend at the med student level, make an outline of your discussion, just a very brief outline, like one bullet point for each paragraph. You don't need to go into specifics, but you're saying this first paragraph, I'm going to talk about X, second Y, third Z, fourth A, and then just call it quits. The first paragraph though is pretty critical because after someone's read your results, now they're wondering how to interpret them, and this is where your interpretation starts. So your first sentence is kind of sets up how you're going to present your findings. You can either put in here something was significant, or there are very differences between these two treatments or whatever you're studying. But that first sentence is kind of like setting you up for the next couple that will follow and will list your most important conclusions. And this, if you have 10 tables and you have some massive data pool that you did, choose a couple important points that are actually clinically relevant. You don't need to go into every single one of them here. You'll have time later. And then the last sentence should introduce your conclusion, but you don't have to go in depth here. Just kind of give the reader a taste of what you're going to be like concluding and taking away from this paper. And then you'll actually give them the real takeaway in the actual conclusion. So for example, on this one, I gave a historical precedent for what we were studying. Then I gave the patient-reported outcome measure scores, the adverse events, and the benefits of the two different treatments that we were comparing, kind of as like a way to close it out sort of thing. So I, again, strongly recommend having some sort of outline here, and your outline will change based on what you're studying, if you're comparing things, if you're just talking about a history of a procedure, whatever. But that definitely helps to have kind of like a plan in your brain that is approved by an attending. When someone should, or a resident or whoever's in charge of the project should take a look at it and say that looks good, because it really sucks if you write a beautiful discussion and they were saying, wow, I really wish you would have talked about this for 99% of the discussion instead of this. So something to keep in mind. And then your last two sections of any paper you write should be limitations, and then your last one should be conclusion. That is like exactly what your abstract says. So for limitations, you do want to like actually acknowledge your limitations. A lot of times if we're critically reading papers and they skip over their main limitations or they kind of like sugarcoat them, no one's fooled. We're all looking for reasons to doubt a study unless it says exactly what we want it to say because we're funded by someone. Everyone else is looking for reasons to doubt a study. So actually be honest about your limitations and don't try to like justify or write off everything you put down there. Like there was a lot of heterogeneity. And you can say this is useful in this way, but it limits us in this way. But you don't want to just say like, oh, but it's actually a good thing secretly 100% of the time. And then again, your conclusion will match word for word the conclusion on your abstract. It will need to be pretty short because most abstracts are fairly limited. So as you can see, I went methods while I was actually writing the paper, results once I have the data, and then discussion after that. And then I go to the introduction. By this time, I have accumulated a lot of citations that I'm referencing through all the other paragraphs in this section of the discussion. And I kind of know what I'm talking about. I've read a bunch of the literature. I understand what's going on. So then I have a pretty good way to start an introduction. If you actually open a journal or go onto the website and like go on Sci-Hub and just look at a bunch of stuff that's been published in decent journals, you will notice that the introductions are very short, nice and succinct, and they have a lot of citations. That's really important. So your first paragraph should give a brief history of whatever you're studying. So again, lots of good citations is critical here, and preferably multiple citations citing the same fact if you can. And it sounds like, oh my God, I have to read like 9 million papers to find this. You probably will read a lot of papers, but by this time, you've already read so many and you've hopefully been taking good notes or saying this one's good for this one's good for this. That you have like a bunch of things. You're like, oh, I remember this paper talked about this thing and this one did too, and this one did too, and I can cite them all here. And it ends up being very quick. And I think the biggest thing I see among people who start writing papers, especially at the medical student level, is that they'll write a 2 or 3 page introduction. And you're like, most orthopedic surgeons know 99.999% of this information. They don't need it repeated. There are rare pathologies and everything, but people have probably heard of them to some degree. And if you can explain it in 2 or 3 sentences, that's ideal. I put no more than 5 sentences for the first paragraph, and same with the second paragraph. But if you go on into the journals, you'll find a lot of them are significantly shorter than that. Second paragraph being a history of whatever conflict or question you're trying to answer. So you open up with a brief kind of like, here's what we're talking about, quick word on what it is. Second one, here's why it matters. And the third one is the purpose of your study. And I strongly recommend very simple language and no more than 3 sentences here, because again, everyone knows the little paragraph right before the method section starts should tell you exactly what you're looking for. So when you're flipping through studies saying, should I actually read this one? And you see that and it looks good, people are like, oh yeah, this is going to be helpful. Some journals do require a hypothesis. Look at what your study says, look at what the journal is. If you're doing a case series, hypotheses are plus minus useful. You know, if you say like, oh, I think there will be good outcomes with this, like no one really cares. But if your journal does require one, try to make it interesting and try to base it based on what you found in the literature. So this is an example of an introduction, and that second one does look pretty meaty, but there was a lot of conflict over this one, so I made the conflict section a little longer than I normally do. But I believe it is still under 5 sentences, so kind of cool. So then maximizing your research once you've kind of gotten a paper, once you've gotten a manuscript, once you even have some data. So publishing is obviously the main goal. You're doing all this writing, you want to get it published. Authorship this is kind of an important note, and this might be a little controversial. Authorship is typically who writes a lot of the paper. However, their seniority does play a part. It does not, no residency program cares where you are in the authorship line. If you're first, it's very impressive. Last is typically for the most important attending on the study who kind of watched the whole thing or conceived the idea, stuff like that. So the PI will be the last person on your study. The first person is usually a resident most of the time, although sometimes you will find teams that are willing to put medical students as first author, especially if you've kind of proven that you're very worthy and important to the team. But it does not matter if you're not first author. If you're second, third, fourth, the residency program you're applying to knows you probably did a lot of the burden of work leading up to that. So that's completely fine, and don't let it freak you out if you're like, oh my God, I have like 3 papers, but I'm not first author on any of them. That's not a huge deal. Timeline, again, papers do take a long time. Once you submit it, you're looking at a couple months before you get it back. It might just get rejected and then you have to start the whole process again. No, that's part of the process. It's completely fine. If you end up putting it on your residency applications that you have this paper submitted to here, they're going to ask you questions about the paper, questions about your research. I don't know, again, I did not really apply the civilian route at all, but no one ever asked me about my papers that were about like where my research was getting published for the papers that I put in process. They more asked about the content, what we found, interesting findings, stuff like that. And then you should present these things as much as possible. Obviously, it looks very nice on your CV. Oh, here, let's see, got a question. Is it better to have like 1 or 2 first author papers or 5 to 6 second, third author papers? That's a really good question. I don't think either one is better. I think that if you can, I think how you manage whichever ones you have during interviews, during applications, stuff like that, that's what's going to make it a big deal. If you completely did a project entirely yourself, only with the supervision of an attending and your first author, that's awesome. And you're going to be able to talk about that. If you end up being a stats person and you do 5 to 6, where you do a lot of data collection, a lot of data interpretation, they're going to ask you about that too. I really, really don't think one is better than the other. It looks awesome if you have some first ones, but like, if you're turning down a bunch of opportunities to be second or third or fourth, and you're not like, and you're taking a gamble on whether you're going to get a first, definitely not worth it. But if you have some first author publications, that's awesome too. When you get to residency, that changes a little bit. They want to see you kind of being the principal person doing the research, but that's a different story, and we don't even have to worry about that right now. So kind of important thing to think about.
Yeah, I think too, the most important thing is to be able to discuss your research intelligently and be able to discuss your role and what you think the implications of the paper are and what future projects in that field or arena may hold. And that carries over to your residency interviews. I interviewed some of our, for this past year, our, interviewing medical students, and those that had a lot of research or interesting research, I definitely asked them about that. And I'm not trying to grill them, but just to see kind of how they speak about their stuff. And for fellowship interviews, that was a huge part, was thinking critically about what, how you've, digested the literature and what you think the next steps are, and how you can think critically about the results you found or what you didn't find or what surprised you, what you found. So, a couple, big first author publications are really great, but, if you can't speak about what you did or what your role was, or if it was like kind of this quid pro quo from somebody that you knew or whatever it was, then it's like kind of weaker. But like Alexa said, if you're a stats person, and you're like, yeah, I partnered up with this person and I was able to do their statistics, and we were able to find this and this project, this and this project. And, we have these 3 other projects coming in the future. Then it's like, wow, you're productive and you're a valuable member of that research team. And you may not be the person doing the principal writing, but without your stats knowledge, the project would have faltered anyway. So I think that that's also equally important. So I agree with the answer. Very difficult to say one versus the other. I would just say that when you put them on your CV, you should take ownership of them and be confident that you're willing to speak about them, at least, a few sentences on any project.
Yeah,
100%. Sorry, I have like a extra follow-up question. So what about researchers that are non-orthopedics, like medical education or anything else? Like, how do you guys view that?
That is a great question, and I 100% should have put a little bullet point for that in the PowerPoint. So I think that if you're applying orthopedics, you should have some orthopedic research, at least one project. But if you have a bunch of research in other categories, like I did a bunch of research in pediatric trauma before I ended up deciding I wanted to do orthopedics. I had a bunch of weird resuscitation studies on pediatric trauma bay, intubation, CPR, stuff like that. And that actually got asked about. It didn't get asked about a lot. I remember the interviewer was like, so what was this study? And I told him oh, I watched video evidence and recorded when we did certain interventions during CPR, if the CPR was effective, how fast we're going, stuff like that. And he was like, how many died? And I was like, a lot. And he was like, that's depressing. Anyway, tell me about this other orthopedic study. And you're like, okay, cool. Sounds good. They might ask about it just because it pops out and it looks kind of interesting. And you, again, should be able to speak very intelligently about it. Show them that you're able to run a project, that you did other types of research, that your new interest is orthopedics, and you're going to want to make contributions in the field. I think the only red flag that you could see from prior research is if you have some research from your first or second year of college that you used to get into medical school, and you talk about that, and that's awesome and everything, but you haven't done anything since then to try to keep yourself a member of the research community. That's kind of okay, well, it's nice that you did that to get into medical school, but then what does that show right now? Does that kind of make sense?
Yes, thank you.
Yeah, 100%. And again, I'm not saying you need to have 15 presentations and papers in orthopedics or anything, but if you show that you're starting to transition from other stuff to ortho, that's awesome if you have those opportunities. But no one is going to say, I think it shows if you have a consistent record of doing research with other groups, it shows that you are good at research. You can do research consistently. And even if you stayed with the same group for a long time, it shows that you're a team player and you were probably a valuable person on that group. So that's also a helpful thing to think about too. So I would look at it more as trends over time instead of I have 3 papers from this thing and 1 from this thing. They're going to freak out that they're not all orthopedics, And then everything you do you should submit to your institution's research days or whatever you call a research week sort of thing. Absolutely submit there. That's super helpful. Also try to find local meetings that are happening around you. I know that SOMOS, for anyone in the military, Society of Military Orthopedic Surgeons, will take almost anything you give them. It's an awesome opportunity to go hear a lot of really cool talks and get some practice presenting your research and everything. And the meetings are usually in cool places. Conferences are super, super fun. You should try to go to the ones that you can. And there are more local ones than you think that will probably be a couple hours away from where you are. And And again, having posters at any of these things is really helpful. And you should go and you should present your poster. You should be there when they ask you to stand there. And the rest of the time, you should try to find cool talks, go learn new things and go try to meet people. There are a lot of events at most of these conferences to kind of get like medical students together or residents together. I know that AAOS just had a whole like medical student series. Somos does a bunch of things for residents that medical students are always at and welcome to attend, stuff like that. And it's a good place to meet people and actually find mentors too. At the last AOS, the speed mentoring thing, if you ever have the opportunity to go, is fantastic. You can meet a lot of cool people who are looking for researchers there too. Ooh, another chat question. When putting posters on your CV, how many times do you list the same project? That's another really, really good question. John, you might be also able to answer this. I don't have a cutoff. If I see you presented the same one poster at 7 different conferences, I'm going to be like, huh, did he do anything else? But if you're presenting like 3 or 4 posters at 7 different conferences, I'm like, all right, nice, good utilization of resources. I think it's on a case-by-case basis. I would say you should put it at everything you actually presented at. But if you're looking at your resume and you're like, oh, how many times do I need that dumb paper that I really didn't want to write, but it was kind of interesting and I presented it a couple of places because they took it, sort of thing. If you're kind of like that, you could take it off a couple of times, just keep it on there. I think it's like a hard game because I think there aren't really any hard and fast rules with this thing. But yeah.
I would say for like your academic CV, which you should keep and update and save one every single year and have it, a format that you update year to year, and you have old ones you can look back on in case it gets deleted or something. I think you should put literally every single thing you present. For your applications, I think you should, if it's a paper, you should put it as a paper. If you present it somewhere like international or national, put it there. If you present at your school research days, put it there. And then if you do a poster for it, put it there. But if you've presented the same poster multiple times without other research experience, then there may be like you're clearly padding your resume. However, if you have a bunch of research and you're trying to show that you're a research machine, then I would just hammer it. But I think it's case by case basis for sure. But I think for your CV purposes, you should put it's a snapshot of what you have done as a academic person. So you should put everything on there.
Yeah, 100%. Oh, and another question. So how can a second-year student get around having no research and a medical student at a school that doesn't push research, has no home program, you've been trying a few years, but unable to secure a project? Oh, yes, this is a really, really tough situation. And I think it is hard to find people. I will say I do a lot of my research, and Skins has also done quite a bit of this with a guy in New York who we have literally our only connection is through he's friends with one of the attendings at our programs. And he liked both of our research work ethic and continues to help us find and actually take projects to fruition, which is awesome. It's really important to find a mentor. And I think a lot of that will come in terms of reaching out. I would start, if I were you, I would start with MSOS, the Medical Student Orthopedic Society. They are so awesome and they are really good at setting up with mentors. You just put your name on a form. And I will say to keep pounding the people who you end up being like referred to on email. Like, don't be afraid to double text, triple text, sort of thing. Read the vibe first, of course. But sometimes I'll miss a text. If I get a second text, then I'm probably going to answer it. And I'm like, oh my God, I missed your first text. I'll get it right back right now. I would strongly suggest starting with MSOS. And then moving up from there. At these conferences, if you see a paper that's interesting, or you can tell that someone, look at who's writing the papers. If you see a bunch of names without MDs behind them, you know the person presenting that is probably pretty medical student friendly. I would start with a resident. Find a resident or someone before you go straight to an attending and ask for research opportunities, and then kind of try to work your way into a system from there. But that is a really challenging situation, and it's hard to actually find opportunities sometimes, for sure. Especially if you're medical. And honestly though, like it's nice to have the home program is the part that's supportive. Your medical school is probably not going to do anything to support your research, except have a nice library that you can use for good resources. But yeah, and let's see. So I think a couple of things you want to keep in mind the entire time. Yes, that's awesome. That's awesome. Yeah. Struggling but determined is like honestly, the mantra of research. So why do programs care? So contributions, it shows that you can actually be part of a team, make contributions, and this goes in hand with the teamwork thing, and that you're going to carry your load and you're going to take something from the start to the finish, and that you're reliable. Problem solving is awesome. If you come up with a problem and you're like, I don't know how to handle this data point, instead of just emailing a resident or emailing an attending, like, I don't know how to handle this, try to say, this is our problem. Would you like and then put 2 or 3 bullet points on your possible solutions for how you're going to deal with this problem. And they will select one and say, number 2, thank you. Or just type back a 2, and that's perfectly fine. And you know that they're impressed. It really helps if you propose a solution in addition to the problems that you're encountering while you're collecting data or whatever you're doing. And then stamina. Research is a long haul, and it's not always a really good time. So it's important that you kind of keep up the energy throughout the process, and it makes you definitely look good if you're able to do that. So you should, and this is, again, I hope I don't sound preachy here. I really don't want to, but I think that this mentality has helped me a lot. Each project that you get is data that is coveted by someone else that can be very valuable, because publications are the currency in the world of academia. So you're basically being handed free academic money, and you need to understand that and treat it as a privilege. As a medical student, you should also treat it as a prolonged interview, especially if you're working with residents, because they're going to see you and say, oh, do I want to work with this person going forwards? So even if you're not super interested in like whatever project you're doing, if it's something you find boring, which I think most things I'm able to get excited about. I don't have a lot of things that I'm like, this is incredibly, incredibly boring. But you should kind of get yourself excited about whatever you're working on, or at least see it as an opportunity to prove yourself to someone else. And then obviously an opportunity to dominate, because you want to show someone that you are like an awesome and hardworking person and keep it going from there. And then these are just a couple like takeaways for how to really, really make yourself look good in research. And again, I might sound preachy here. And then one of the other residents can yell at me if I do, but I think the biggest one, and one of the senior residents once told me that the role of a medical student is to be a happy sponge. I'm curious if any of the other residents know who said that. Someone said the role of a medical student is a happy sponge. You want to take in all information you possibly can while bringing a good vibe to the team. You don't want to be a downer. You don't want to complain, nothing like that. And the exact same thing applies in research. Learn some new skills, learn some new Excel formulas, learn how to use a new programming system, whatever, and be enthusiastic while you do it, and you will look awesome. So for reliability, you need to know your role. And this is sometimes where the person in charge of you can fail. And it's hard for you to pick up that task because you don't want to sound bossy or pushy or anything, or like, oh, am I doing this? Or you don't want to feel like you're getting out of work. But it's really helpful for you to know your role and have specific designated tasks. And again, instead of asking an open-ended question like, what do you want me to do? Ask, should I start with X? Should I start with Y? Should I start with Z? And this is kind of general residency advice, and you kind of not just limited to research, but hopefully it is very applicable to research and will help you as well. Punctuality, know your deadlines and communicate early and often. If you're not going to meet a deadline, most of us don't care. Most of us don't care at all. It just might affect what time I'm going to do my research, how I'm going to plan my week, sort of thing. So as soon as you're like, oh my God, I'm taking step 1 in like 2 weeks, I'm so stressed, I don't have time to finish this right now, I'll do it afterwards. You need to let someone know. We've all been through very busy times. So, and then again, this might just be for me. I don't know if this is for anyone else. If I don't respond to your email in like 3 or 4 days, like email me again and be like, hey, so sorry, checking in. I will never get annoyed. Usually I'll only feel guilty, which is exactly what you want. You want me to feel guilty and not annoyed. And that's like the perfect solution for getting a response. But residency obviously is way busier than medical school. So just keep that in mind and be respectful of other people's time. Responsibility, so take ownership of all your work. Mistakes do 100% happen. Maybe you collected a data point or included a couple of studies that shouldn't have been included, or failed to include some that should have been included. As soon as you realize you've made a mistake, stop whatever's happening so it doesn't keep on going. You don't finish the project and say, oh crap, I shouldn't have collected that data and now all of our results are messed up. Stop early and then communicate your mistake and say, here's how I'm going to fix it. Don't kind of just hand it off to someone else and say, I'm sorry, I couldn't figure that out. It's your problem now. That sucks, and that does not make you look good. So honesty and integrity, this kind of goes in hand with all the other ones. This is like, reputation is critical. Another John Scanaliato saying, your reputation is everything. You are establishing your reputation from the first project you take on a research team. If you do well on this, you're going to be sticking around. If you don't, you're going to fade into the ether and never do another research project. Which for some of you who only want one project to kind of talk about during residency applications, that might be okay, but you don't want to burn those bridges, and you will burn bridges if you're lying about how much you've done, how much you're able to do. And again, most residents have at some point procrastinated. So if you're procrastinating something and you're going to pull an all-nighter and get it all done that day, totally fine. we don't usually mind. Just don't lie about how much you've done so far if you've done it. And then I think this is my favorite one, is graduated indispensability. You want to make sure that you are learning skills that will make you a critical member of a team. If you know how to run a stat, if you taught yourself based on YouTube, Google, whatever programming software you found, if you've taught yourself how to run stats for your teams that you can see that they like, you're going to be sticking, they're going to rely on you and they're going to need you there too. That being said, you do want to teach those skills to other people so that you're not the only one they're relying on, because then you're going to be overwhelmed with your work burden. But if you are the one who learned how to use a new software, that's super, super helpful. I think, like, for me, I learned how to do a systematic review, run the data for that, and take it to completion. And then now I can tackle systematic reviews, and that if anyone needs a systematic review, like, I can teach you how to do it, or I can help you out with it. And that's kind of, if you can establish your role in that, that is really, really helpful as well. So then a bunch of the questions that we got on the survey. So best way of finding research when your school's not a home ortho department. We kind of covered that, but it is difficult. Start with big organizations like MSOS, AAOS. A lot of them, again, MSOS has the best mentorship program, I think, at least, and go from there. Try to meet people, conferences, anything like that. And if you see people who are super active on Twitter and they're talking about their research, and then again, not that they're showing what they've published, but more so that they're saying, like the guy that I DM saying, like, anyone want this project? Like, reach out. That's a great opportunity. Hoping to learn more about the active projects. Yes, we can talk about that. I'll talk about that at the end here. Absolutely. So Army specifically values it in residency admission decisions. It is valued. It is valued. I think so. In the Army, typically what happens is all the residents and the attendings will review the applicants either together or separate, depending on which program we're talking about. If you have no research, it is kind of a red flag. It's, again, I'm not saying that you won't match if you have no research, but having research means that you're able to find something you're interested in, or you're able to make friends with someone who trusts you, and you are able to complete a project. It's kind of a little bit of collateral on your ability to have stamina. Oh yeah, go ahead.
So I've been a little bit more intimately involved with residency admissions decisions, and I think we're going to have some more open houses over the summer, so I don't want to get into like the art of wooing a program. But the way it works in the Army is you rotate at whatever programs you rotate at, but at the end of the day, every applying medical student to Army programs gets ranked on one big rank list from, let's say there's 30 applicants, from 1 to 30. And let's say the Army has authorized 23 spots that year. People ranked 1 to 23 will get a training spot. The other people ranked 24 to 30 will not get a training spot. And then, you know, there's rank lists at the various programs. There's the students rank list, and then they do the match process. But what that means is that even programs that you don't interview at or rotate at are still going to rank you in their 1 to 30 or 1 to, N rank list. And if you don't rotate there, you do a phone interview and stuff, but they're still going to look at you at paper. They're going to talk to you. They're going to probably talk to other program directors. Other residents are going to talk to other residents. They're going to talk to their program directors. But at the end of the day, we really like numbers for finding ways to like deciding between number 20 and 21 or 22 and 23. If you are somebody who doesn't have, let's say everything else is equal, you have equal number of programs saying you're a great resident, you're a hard worker, you carry splint supplies really well and can cut off dressings in a skilled manner and cut sutures to the right length. Your scores are the exact same and everything, but one person has good research and one person doesn't. I can almost guarantee that the person with better research is going to get bumped up into that rank list. So with step 1 going pass fail, step 2 is now becoming more important, but we're always striving for this objective way to rank people, and that whether or not it's right or wrong is an argument for a different day. I think that research says a lot about people's personality and some of their character traits, but I think it is important, and it's something that I've seen that people do talk about when ranking medical students, especially those that we don't have face-to-face time with, and we're just looking at a CV or something. So it is important, and you have to remember that you're trying to not only impress the programs you want to go to, but you want every other program to think that you are a well-qualified applicant too.
100%. And programs want publications. It makes them look good if you're going to conferences and you're showing all of your incredible work and you're establishing a great reputation for the program. So they want to see that you're going to be able to do stuff as a resident and make your program look good for sure. And then how to get involved with research on a home orthopedic program, and then I'll get into opportunities a little bit later. So I'm involved in multiple projects, but most will not be published in time for residency applications. How much weight do you hold for publications versus taking part? Great question. As long as if you are able to talk intelligently about the publication that you are waiting on, whether you've submitted or you're doing, or even if it's not fully accepted anywhere or published, that's awesome. If you're able to complete research, it shows you're active in the field. That is really fantastic. It can be difficult. It's nice to have a publication. It looks really, really great if you do have a publication, but I wouldn't be super, super concerned to have a giant chip on your shoulder if you have like 3 or 4 projects that are submitted to journals. Like, it shows you're productive. Oh, another one here. Oh, okay. So I think yes, I think the kind of the big takeaway from that one is that as long as it shows you're active, you're able to be academically productive and you're getting more and more involved, that's totally fine. Tips you have for MS2s about to begin MS3 who want to write and help us with case reports. That's a great one. So case reports, obviously, they do have a little less weight than other types of studies. Just in terms of a case report is like, one patient where you talk something interesting. They're helpful and it's a great way to get a publication, and you should definitely be able to talk about it. You're probably going to get asked about it, et cetera. That being said, it looks good and it's helpful. I think if you do an interesting case with someone, or if you're working with someone for your home rotation for 2 weeks or something, and you say, oh, hey, do you have any things you want written up as a case report? Some of them might have a case or 2 in their back pocket. The most important thing you do with a case report is that you take it from start to finish by yourself, and you give the attending in a reasonable amount of time a like nicely polished, delivered project. If you don't have any residents working with you on them, sometimes you don't, find a resident, ask them to look at it, or find someone who is good at research or has a bunch of case reports under their belt who can look at it and say, yeah, this is what they're going to look for. Then give a kind of a draft to the attending and say, what do you think of this? The biggest thing with case reports is that you don't want to burden people with them too much. It's something that you can pretty much handle at your level, and you can do a lot of research with on your own time, and find a lot of other papers that you can kind of publish kind of as like a kind of outline or framework for how you're going to do yours. But yeah, that's another really good question, because case reports are very fruitful and they tend to get published pretty quickly. But of course, most case reports do not make it to a really big journal or anything, which doesn't matter as much at your current level, but it does show you are able to like write a project, get involved, that you're probably taking initiative on the subject, stuff like that. How can you get involved with orthopedic research at their institutions? Again, same sort of thing. It's hard to get EMR, but some attendings have their own people who will pull data for you. A lot of bigger institutions will have research teams and people who are able to get that sort of information, and then you can get it de-identified and do the writing. Same sort of process as finding a mentor elsewhere. But yes, the hardest part is finding that person who wants you to get involved. But once you find someone, like, that's a critical opportunity, and then you really want to do your best to not let it get away. Some important timeline and project progress inquiries we should make when trying to discern whether a product will be ready to publish or present. That's a really, really good question. Obviously, know the deadlines, and a lot of times it's really helpful to send the attending, if you're wondering whether you have time to publish it, send the attending an email saying, I think I can get this ready by this day, which means we could submit it at this time. What are your thoughts? If you have someone else pulling your data or running your data, make sure you check in with them and see if your data will actually be ready. You don't need to have a manuscript to submit something to a conference. You need an abstract. I didn't talk about writing abstracts in this. I always write my abstracts last. I should have put a little blurb on that. But basically, just look at your journal, see how many words you have, see how many words the conference will let you put on an abstract, write your abstract and submit it and go from there. If you do get something accepted, you actually want to make sure that it's something you can actually go to. There are a lot of meetings do have consequences. If you get it, submit it, get accepted, all that stuff happens. And then you end up getting, like pulling out. That doesn't look great. Some have like a ban on how long until you can come back or submit again, sort of thing. So kind of look into that. But it does really help to send the whole team an email or in pieces with the deadlines and whether they think it will be achievable if you have any concerns that you're not going to have the data in time. Some conferences too, and this is kind of more on the small conference side, the big ones won't do this. If you submit something saying you have 50% of the information, but you will have it by the day, and you write it very carefully worded, or you say we have the data from 2015 to 17. It will be completed up till 2020 by the time of our presentation, sort of thing. Some of the smaller ones will be completely fine with that. Some of the other ones won't. So play that by ear. How should an HPSP student interested in ortho get involved in military research? Another great question. SOMOS is the perfect place to start if you have the opportunity to attend SOMOS. Also finding the nearest MTF to you, or any sort of other military physician in your area, and reaching out to them, kind of seeing if they're doing research or seeing who is doing research. That's also really critical. The military community is pretty small. And I will say, if you are doing research within the military community, all those things I talked about in like being reliable, being trustworthy are even more important, because everyone talks, and you will learn this on your interviews and everything. People will already know who you are before you even go to their program. And that's really critical. So you really, if you are doing research in the military, it's really important that you do a good job and you take full initiative and get stuff done. And emailing someone back, I don't know how to do that, is never the answer, speaking from experience. So we talked about the one no home program. How can a fourth year medical student get involved in research during an audition rotation? Another great question. So typically when you're on a rotation with someone for like your 2-week rotation, or if you scrub one case with someone, they're probably not going to have any interest in doing research with you unless they need like warm bodies to write papers. If you spend 2 weeks with someone and you show that you're really good and reliable as a medical student, and then at the end you say, during your feedback session or whatever, it's a good point where you say like, thank you for your time, sort of thing. If you say, if you have any research projects, I'd be thrilled to get involved. That's a perfect thing there. Or you can also kind of do the kind of quiet introduction way where you start dropping hints. You're like, oh yeah, I'm working on this project. I love this one so much. I love doing research. I am looking for more though, because we're about wrapped up with this one. And then they usually pipe up like, oh, we have a couple, or if they say nothing, you probably shouldn't ask about it anymore and probably just call that one quits. But it is really helpful, because when you're rotating at all these programs, it's helpful that you actually contact the attendings, talk with them, and show, and this is again an opportunity for you to do a really good job. That being said, that is a really critical one that you don't mess up. If you are a great medical student and you're doing all that, carrying the plaster, getting the splint stuff set up, you're doing a good job at all that stuff, and then you absolutely drop the ball on a research project and mess something up, and not in a way like where you're kind of just like pulling out, you're like, oh, I'm a 4th year medical student, I'm done with everything. I'm not really interested in finishing this research because match day is coming up. They probably already submitted their stuff. That's not going to look good for you. And you definitely don't want to treat it like an interview, because it pretty much is, especially if you're doing stuff during audition rotation. Case reports are a great option during audition rotations too, a kind of nice, easy, bite-sized piece on how to start and finish a quick research project with someone and show that you're good at doing it. That's not going to take a long time for data collection. And then how to balance classroom and boards prep with research during MS1 2 years. An excellent question. I started doing research with Beaumont as a, I think it was an MS1. I think it was like towards like the end of my MS1 year where I was almost an MS2. You have so much time in your early years of medical school, even though it doesn't feel like it, and you're studying all the time, and it's very stressful, and you definitely have to study for STEP, all that stuff. You don't want to fail STEP, a million things going on. But if you say, okay, Wednesday afternoons from 2 to 4 p.m. are my research time, and I will get X, Y, and Z done on my checklist during then, you're going to be able to manage your research burden just fine. I would put a couple hours a week towards research in medical school. And I think more so than just like at padding my application and CV and stuff like that. It's actually interesting, and you learn so much when you're doing research, and you read a bunch of papers and you kind of get a feel for what's happening in the literature. And in those early years, you're kind of still deciding what you want to do. Doing research kind of helps you decide if you actually like thinking about the topic, and if that's something that could be worth applying to. And again, orthopedics is very broad. There's a lot of different fields within it, tons of different things for whatever you're interested in. But if you don't like thinking about the million orthopedic topics you're reading about for a research study, it might be an indicator that you're kind of looking at the wrong field, sort of thing. So that's also something helpful to think about. That's all I have. So I'm putting up 2 emails here. Chris Botchok is one of my awesome co-interns. He is currently running a research program for medical students. And this is a great opportunity to get a paper that will almost certainly be published in the Journal of Orthopedic Business. A lot of these are business papers, but we're branching beyond just the business papers for Chris's whole opportunity setup. He typically we teach people how to write these business papers, which will likely get accepted to the Journal of Orthopedic Business, which is run by one of our absolutely brilliant residents, Dr. Ben Childs. And it's helpful having a journal out of your own program. We're all learning, and it's a phenomenal resource, and it's a very cool journal that talks on a lot of really interesting topics. But it's a great way to get involved and kind of get an idea for how to start these projects. And we have some easy templates that kind of make it more straightforward in collecting data. All the studies that we're starting with, or that are kind of in this zone of our research department in our whole program, are typically systematic review or scoping review style studies, meaning that you don't need institutional access, and they usually go pretty fast as long as you put the time into them. So that's another really good resource too. If you do want to get involved with research here, you can email myself and Chris, and just email us both together, and we'll do our best to find a home for you. Obviously, I can't guarantee a project to everyone, just because I don't think anyone has that many ideas or bandwidth to supervise, but we would love to help you get involved or help you find connections and resources and stuff like that. Anything else to add, friends?
Yeah, I have a couple of points. Obviously, Alexis did a great job, and very, very thorough, and tons of great points there. I just have a couple. So know your strengths, and Alexis already mentioned this, but if you were an English major and you're really good at writing, you should do writing. If you're a math major and you really like stats, or you're really proficient in SPSS or Excel, be marketable in that and do stats. And for me, I don't particularly love writing. I'm not bad at it, but I'd rather do the stats. So a lot of times, I've worked with Alexis and John on papers where I get the data, I create the tables, I write the methods and results, and I give it to them, and they just take it, and they do the intro and discussion. And just because you're on the paper doesn't mean you have to do everything. So if you can divide and conquer things like that, it makes it a lot more manageable, and then things get done in a more timely manner where you're not getting burnt out on one paper. So I think, know your strengths, and then again, be marketable in that regard. She mentioned it, but be timely, dependable, and transparent. So set timelines. You don't, if you have a shelf coming up this week, don't say that you're going to finish your intro or these 2 paragraphs by Sunday. Just give a good timeline. And we're all human, we're all very busy, and things come up. A lot of times I'm like, I don't have much going on today, I'm going to sit down and knock out the discussion. And then next thing you know, you get called to go do some trauma or cover down, and that day is gone. So if those things come up, just text us, email us, and let us know. And, we're never going to hold you accountable for that. If that keeps happening, you pushing it down from 1 week to like 4 months, that's a little different. Don't overextend yourself. Research is great. Obviously, getting publications is awesome. And, the Army has like that point system. So getting research counts as points. But don't overextend yourself. If you don't commit to like 15 projects where you physically can't do it, it's going to sacrifice your rotations, and you're going to do really bad on all your in-service exams and things like that. Take manageable pieces, start out with 1 project. And then if you feel like you can manage that and you can balance things, you can increase it. You don't have to have research to match an ortho. Obviously, it's enormously helpful, and it does make a difference. Like John said, if you're the same on paper from applicant A to applicant B, but applicant B has 3 publications, they're going to get this a lot, but it's not mandatory by any regard. A lot of people don't have research going into it, and I think more so in the military than in the civilian world. So don't kill yourself trying to do it, but obviously it's beneficial, and that's why we had this talk, to help increase your efficiency and try to get you some publications. And last thing, no one mentioned it, but we won the Somos Research Award for the 4th time in a row this year. So, and mostly thanks to Alexis and John here. So they probably accounted for half of our publications, I would guess. So if you don't know Somos, it's an annual conference that we have in December, the Society of Military Orthopedic Surgeons, and every year they look at all the military programs, Army, Navy, and Air Force, and whoever publishes the most gets the award. And this year we won it for the 4th time. So despite not being the largest residency or not having a research year, we're very productive, and these people know what they're talking about. So that's all I've got.
Yeah. I should add to, like, when you start, this is like a really, really dumb thing, but I think as a medical student, you're always like, oh God, what do I call people? Always call everyone you're emailing doctor. It's just polite to do. Most residents, like, I will say, please don't call me that sort of thing. I think everyone else in the upper left-hand corner will as well. But that being said, it's like, be formal in your first couple emails, and hopefully you can establish more of a working relationship over time too. It's like those first impressions are really important. Cool. Oh, you said awesome. Yeah, I mean, it's in Vail, so like, bring your skis, man. It's gonna be great.
Somos does they alternate golf weather and snowboard and ski weather every year. It's by design. So I'm like not in there. There we go. Which is really awesome. 2 years ago it was in Tahoe, and we got 85 inches of snow in like 2 nights, and the whole resort lost power. We had country club days at Palisades at Tahoe. And I mean, it was a blast. So Somos is incredible. It's a fun meeting. It's not like sit and listen to lectures all day meeting. It's more so to network and have a great time. I mean, most orthopedic meetings are like that anyway. But yeah, you know, if you haven't gotten started in research now, don't get discouraged. Doesn't mean like you're never going to get good at research. I did a little bit in med school. My first and second year, I dabbled in some, but I was trying to learn how to be a resident. And really my third year is when I kind of, all the work I put into building these networks and building up other people and kind of sifting through who I could work well with and what I was good at. That's when it really started to pay off. And it went from like, you know, 1 or 2 publications with some posters and presentations in med school to maybe 3 or 4 publications my PGY 1 year, maybe 4 my PGY 2 year, and then like 16 my 3 year, and then 20 plus my 4th year. And it's kind of been exponential since then. So you build this momentum that you keep going. So if you think you're behind behind the curve, you are not, for sure. Absolutely not behind. It doesn't mean that you're like lost. And there are people who go to schools or our programs where they're literally handed research, and it doesn't mean they did anything for it. They're just put on papers. And I don't know, I like to know that I did something for the research I'm involved in. I think it's a lot more important.
100%. Oh, another question. Any recommendation for the best conferences event in the civilian world? Yeah, 100%. AAOS, the Academy, American Academy of Orthopedic Surgery, it is phenomenal. It is huge. It is so much fun. There are so many good opportunities, especially for medical students and like junior residents and everything. It is like, it's awesome. Yeah,
I think if you can get your school to fund, or you can find a way to fund it yourself, 1 meeting per year, it would be Academy, AAOS. They rotate like 5 or 6 cities. They do San Francisco, Vegas, Chicago. I forgot the other few. We just had it in Vegas this past year. It was at the Venetian. It was a blast. I mean, again, big networking meeting. All the rep companies and implant companies have dinners and happy hours every single night. The poster hall is a great spot to, you know, get research ideas. The talks are all good. They're dialed down. When you get to like the subspecialty meetings, you may be a little over your head as a medical student. Like, what are they even like? What is the glenoid tract? And there's like a 2-hour ICL dedicated to it. And you're like, I don't freaking know what this is. But Academy, it's stuff like top tips for, you know, what's new in trauma this year. And you're like, oh, cool, I can digest this and be able to talk about it, my interview rotations, or bring things up, you know, at interview rotations. Or if you're asked something like, oh, when I was Academy last year, so-and-so from this institution talked about the benefit of dual plating distal femur fractures. And like, oh, wow. Yeah. And then all of a sudden you sound like, you know, a stud or studette versus if you go to like the AAH, one of the hand meetings, and they're like talking about scaphoids all day, and you see one scaphoid your whole away rotation, you're like, oh, well, cool. I kind of missed. So yeah, Academy for sure. Yeah, definitely Academy. Also look for scholarships. Ruth Jackson, I got a scholarship there when I was in medical school. They paid, of course, COVID canceled the conference that year, but it was a nice gesture, I suppose. There are a bunch of different scholarships you can get to go. Oh, Orlando. Yeah. It was Orlando because they had like Disney things, like they sponsored stuff, like they closed the park for 2 hours before it opened for Academy or something, whatever, or opened it 2 hours before, whatever. They had like a dedicated Academy time. So a bunch of knuckle draggers were walking around Disney, or were going to, and then COVID ruined everything. Yeah, but look for the small organizations too in orthopedics. Like Ruth Jackson's awesome. I love that place.
a great one. And it's just kind of like look up for kind of niches or what you're interested in or any diversity groups that are really, really fantastic. So keep an eye out for that stuff too.
And I think Academy for med students is like $99 or $199. It's like, I know money's tight as a med student, but it's okay. And they're usually in cities that have good flights. So you can get like flights pretty cheap and housing pretty cheap. And $50, $50. That's like 1 cup of Starbucks coffee is what all the financial planners say, right? You just cut out Starbucks for a week and you get $50. So there you go. You can go to Academy.
Yeah, I don't know. I stayed at my sister's on this call, Claire Sandler, because she has done a research project with me. And the nice part is if you're doing a research project with your bitchy older sister who bullied you through your entire childhood, she can just yell at you whenever she's not happy. And you can say, can you stop doing that? Which most residents will never, ever, ever do to you or put you through what I put Claire through on the rig. But I did get to stay with her when I went to AOS in Chicago, which was great. And she had to listen to me talk about all the cool things I saw every day and not shut up about it.
Yeah, and like if you do, then like Academy, you're more likely to run into residents, and if you've done research with them, it's like, hey, can I, come out? We had some students who had like met us at so much fun, we were playing craps all night and stuff, but like just you find that residents are pretty decent people. Most of us are, at least in our program. So we love to meet people we work with in this virtual world that we're in now.
Definitely go to the mixers. Mixers are a pretty safe place to find people who actually want to meet people.
Oh, yeah.
It's like very intimidating to go up to someone and be like, are they looking for someone to like ask them questions or hang around with them? And they aren't always, but at those mixers, like everyone's usually pretty friendly and they want to be there for a reason so they can say hi.
For sure. Versus like the joint surgeons, like self-specialty meeting. Like don't
go to
there. Just
don't go talk. Don't go like introduce yourself to random people there. Not good. Not a good look. If you do see Alex Gu around though from GW, just absolutely follow him. He usually has a posse of like 30 people following him around just because he's very friendly and good at making friends and likes that sort of thing. He's always a safe person to join. Good safe man.
Sweet.
Cool. So that's all the program we have planned. Feel free. Alexis shared her contact info. You all should have got an email from me about the Zoom link. So if you have anything that comes to you later, get in contact with us. On a side note, this is, part of a kind of outreach series to medical students. So this one, obviously about research, but we'll be hosting one most likely May 31st around this time. It's another Wednesday about audition rotations at medical students. So it'll be more geared towards the rising PGY4s on these away rotations, how to, excel. And so we should have some good stuff there to, kind of help prepare you guys for success kind of as you proceed with the whole residency application process. It can be daunting, but we've all been in your shoes at various, points in the recent past and have picked some stuff up along the way that we're kind of happy to share.
And the thing about Army Ortho is whether we have civilians or Army people on, whatever the mix is, I think it's mostly Army, but it's a really small community. And all we ever want is to train the best pool of surgeons every single year. We say that all the time, and it's totally true. Because in the military, you never know what duty station you're going to end up at. God forbid you get hurt downrange. God forbid one of your family members gets hurt. You're going to be training the people who are going to be taking care of you and your loved ones, which is really something that we all kind of hold close to our heart. So whether you want to end up at our program or if you think that El Paso with 300 days of sun and the best weather in the country is the worst place in the world, wherever you end up, I want you to be a great surgeon that's going to succeed and do really awesome orthopedics and continue to build this wonderful community. So, just maybe you're not like, or you have to couples match somewhere, whatever it is, doesn't matter. Like we're going to give you tips to succeed everywhere. So definitely attend that for sure. And I think we'll have people from different year groups to give like the PGY 4-5 point of view versus the 2-3 point of view versus the intern point of view, because all those are very unique in what they look at in med students. And where people have failed in the past is focusing too much on like hanging out with chiefs in the OR while the juniors getting their teeth kicked in the emergency department for like 14 hours straight. I like to think I'm fun to hang out when I do surgery, but I don't have to do reductions during the day anymore. So my life's a lot better.
Yeah. So just a taste of what's to come. But anyways, guys, appreciate your time. We'll wrap things up here and look forward to kind of hearing from you guys, or you'll be hearing from me soon in the near future. But everyone take care. Enjoy the rest of your nights. Thanks.